watching Little Albert's Corner on D. I bet you don't know anything about Psych Station. I'm your host, Mamus.
And I'm Ethan. Let's get right into the news.
Our first story of the day, OCD. Do you have it? Probably not. But there are millions of individuals in our country who are plagued by this mental illness.
If you don't know what OCD is, OCD obsessions are repeated, persistent, and unwanted thoughts, urges, or images that are intrusive and cause distress or anxiety. You might try to ignore them or get rid of them by performing a compulsive behavior or ritual. These obsessions typically intrude when you're trying to think of or do other things.
Examples include fear of being contaminated by touching objects that have been touched, doubts that you've locked the door or turned off the stove, or intense stress when objects aren't orderly or facing a correct way. OCD compulsions are repetitive behaviors that feel you feeling driven to perform. These repetitive behaviors or mental acts are meant to reduce anxiety related to your obsessions or prevent something bad from happening. However, engaging in compulsions brings no pleasure and may only offer temporary relief from anxiety.
There are various factors that scientists and psychologists alike have concluded to cause OCD. First, some think it is a genetic disorder. OCD may have a genetic component, but specific genes have yet to be identified. Next, learning. Obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. And finally, biology. OCD may be a result of changes in your body's own natural chemistry or brain functions.
The most effective treatments for OCD are cognitive behavior therapy and or medication. And specifically, the most effective treatments are a type of CBT called exposure and response prevention, which has the strongest evidence supporting its use in the treatment of OCD, and or a class of medications called serotonin reuptake inhibitors or SSIRs. And now to Ethan for this quick message.
Have you or someone you know been diagnosed with hoarding disorder after purchasing a pillow pet and realizing that you have to collect them all? Have you experienced an excessive need to acquire items that are not needed or for which there's no space? Have you experienced a persistent difficulty throwing out or parting with things regardless of actual value? Have you built up clutter to the point where rooms become unusable? If you have experienced any of these symptoms and purchased a pillow pet within the last 5 years, then you might be entitled to financial compensation. A recent study found that anywhere between 25 to 30% of people who have purchased pillow pets suffer from hoarding disorder. Psychologists aren't sure exactly what causes hoarding disorder, but genetics, brain functioning, and stressful life events are being studied as possible causes. What psychologists do know, though, is that pillow pets most definitely have something to do with it. If you constantly wonder why you experience pain at the thought of getting rid of your pillow pet, then there's something that CJ Products doesn't want you to know, that you are not alone. If you or someone you know suffers from hoarding disorder after purchasing a pillow pet, then don't wait. Call 1-800-PILLOW to set up a free consultation today. I repeat, call 1-800-PILLOW to set up your free consultation today. Don't let hoarding disorder control your life. Call 1-800-PILLOW to get your life back on track.
By the way, we are legally required to tell you that if you want an actual treatment, you should call your local psychologist for a cognitive behavioral therapy. Also, there are currently no medications approved by the Food and Drug Administration to treat hoarding disorder, but a psychiatrist may prescribe medication for other disorders such as anxiety and depression if appropriate.
Now, sending it over to Mamus to close out our show by talking about Body Dysmorphic Disorder.
Body Dysmorphic Disorder is a mental health disorder in which you can't stop thinking about one or more perceived defect or flaws in your appearance. A flaw that appears minor or can't be seen by others. But you may feel so embarrassed, ashamed, and anxious that you may avoid all social situations. The most common features people tend to fixate about are their face, such as their nose, complexion, wrinkles, acne, and other blemishes, their hair with thinning and baldness, and their skin with their vein appearance. And some symptoms of body dysmorphia include being extremely preoccupied with a perceived flaw in appearance that others can't see or appear to be minor, strong belief that you have a defect in your appearance that makes you ugly or deformed, and strong belief that others take special notice in your appearance in a negative way or mock you. It is not known specifically what causes body dysmorphic disorder. Like many other mental health conditions, body dysmorphic disorder may result from a combination of issues, such as a history of the family disorder, abnormalities in the brain, and negative evaluations or experiences about your body or self-image. Cognitive behavior therapy for body dysmorphic disorder focuses on helping you learn how negative thoughts, emotional reactions, and behaviors maintain problems over time, challenging automatic negative thoughts about your body image, and learning more flexible ways of thinking, and learning alternative ways to handle urges and rituals to help reduce mirror checking and assurance seeking. Teaching you other behaviors to improve your mental health, such as addressing social avoidance, could be other solvency as well. Although there are no medications specified from the Food and Drug Administration to treat body dysmorphia disorder, medications used to treat other mental conditions such as depression and obsessive compulsive disorder can be effective.
Thank you for tuning in to this special episode of Lil Albert's Corner.
Make sure to tune in next week for Sigmund Freud, Fact or Fiction.
And as we like to say here on Lil Albert's Corner, be excellent to each other.
And always fear little white rats.
Thanks for watching.